Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Friday, July 31, 2026, episode 89. Today, the result that counted was an outcome, not a launch, and what changed around it was the routing. 11 New Jersey hospitals wiring an AI deterioration score into their rapid response teams, Bengaluru sending robots into its water mains at no cost to the utility, 7 Nigerian civil society groups funded to argue with their own government about AI, and a data center crew in Indiana cutting the line that fed 4 tornado sirens. We start in New Jersey, where RWJ Barnabas Health and Rutgers Robert Wood Johnson Medical School just published a study on an AI deterioration score wired directly into hospital rapid response teams across 11 hospitals.
What makes this significant is the endpoint. The result is measured in deaths across 23,132 high-risk patients in 11 hospitals over the study window.
The numbers are specific. Deaths among high-risk patients fell from 23.1% to 18.6% after the system went live, an 18% reduction in the risk-adjusted odds of dying in hospital. Rapid response team activations rose from 25.3% of high-risk hospital stays to 37.5%, and transfers to intensive care did not increase significantly.
The model is the easy part. The researchers do not credit it alone. They attribute the benefit to staff education, alerts in the electronic health record, and automated rapid response notification working as one system. The tool, the Epic Deterioration Index, reads vital signs, labs, nursing assessments, and age that were already sitting in the record, and recalculates every 15 minutes.
Lead author Thomas Nahas, an intensive care and clinical informatics physician at RWJ Barnabas, framed the goal as catching patients before they reached a point where intervention becomes much more difficult. Rutgers reports the index spent several years in a single hospital first, Robert Wood Johnson University Hospital, tuning how and when alerts fired before it went system-wide.
So the operational pattern here is the routing. Who gets paged, how fast, and what they are trained to do on arrival. And the authors kept one check in view. Intensive care transfers did not rise, which means the earlier alerting was not simply moving patients upstream.
Moving to India, Deccan Herald reports the Bengaluru Water Supply and Sewerage Board announced on July 29 an 18-month pilot that puts AI analytics and robotic inspection inside the underground mains carrying Cauvery River water to the city. It starts in the Bengaluru South Division.
What makes this significant is the procurement. The board pays nothing. The pilot is funded through Titan Company Limited's Design Impact Award, with the vendors and Vilgro Innovations Foundation carrying the cost of the proving period.
2 vendors split the work. Smart Terra runs predictive analytics to flag which pipeline sections are most likely to fail and acoustic sensing to locate leaks without digging. Selena supplies the in-pipe robots, which travel inside the mains looking for structural defects, blockages, and hidden leaks that conventional surveys miss.
The constraint is capital. Non-revenue water is a known problem in fast-growing cities, and what usually stops a utility is the budget request for an unproven inspection method. One division, 18 months, no citywide commitment. What the board publishes at the end decides whether this deployment is replicable elsewhere, and the 2 numbers to look for are leak detection rates and dig avoidance counts.
Story 3, Nigeria. Premium Times reports the Center for Journalism Innovation and Development has selected 7 civil society organizations for a new round of AI advocacy grants under the Nigeria AI Collective, announced July 29.
What makes this significant is who is on the list. TechHer, the Cedar Foundation for Disability, the Akin Fadi Foundation, the Nest Africa AI Innovation Lab, the Webfala Digital Skill for All Initiative, the African Center for Media and Information Literacy, and the DataFight Foundation. Disability rights and data journalism on the same grant line as a policy shop.
Each organization runs its own advocacy project built around its own constituency, rather than a single common work plan. The center runs the collective on a grant it won from Luminate. This is capacity funding rather than deployment funding, deliberately small and distributed.
The governance constraint is representation. Most AI governance money in low- and middle-income countries lands on ministries and universities, which leaves the people most likely to be misclassified by a public sector system without a funded advocate in the room when the national strategy is drafted. 7 organizations, 1 policy process, and a template that is cheap for other funders to copy.
Pivoting to Indiana, The Sullivan County Emergency Management Agency posted on Monday, July 27, that a company building the new data center had accidentally hit a power line running 4 of the county's tornado sirens. Severe weather was moving toward the area at the time.
Silent failures are the worst kind. 3 of the affected lines sit near the power plant area, 1 serves the city of Sullivan, and a single cut cable took all 4 down, on a site whose entire purpose is redundant computing.
County Emergency Management Director Jim Pirtle said he had talked to the technician and crews were repairing the line. No injuries were reported, and mobile alerts and other digital channels stayed up through the outage. The campus is being developed by Potentia at the county's Heartland Industrial Park.
The question residents asked, and local and national coverage carried, is why outdoor warning sirens in a tornado-prone county have no independent backup power at all. That is the operational gap. Utility locate and critical circuit protection sit with the contractor rather than in the construction permit, and the build-out is accelerating across the Midwest and South, which is the tornado belt.
On the disaster watch, Relief Web opened situations on July 27 for floods in Tajikistan and flash floods in Kyrgyzstan, and forest fire alerts remain live in France and Tunisia. There is a red alert on flooding in China, with 10 deaths and 801,000 people displaced since July 25. And the United States Geological Survey logged a magnitude 6.8 earthquake at Udo, Japan. On July 28, with roughly 1.2 million people potentially exposed to strong shaking.
Tajikistan and Kyrgyzstan both opened 4 days ago with casualty and displacement figures still not consolidated. So for now, the alert itself is the whole picture responders have. That is the same dependency Sullivan County exposed at a much smaller scale, where the hazard was known and the notification path was the part that failed. Warning systems break at the last hop.
Funding Watch, the Global Disaster Preparedness Center with the French Red Cross Foundation, has spotlight research grants of $10,000 each open for researchers based in low- and middle-income countries on the accountable use of AI and other information technologies in humanitarian action. The deadline is today, end-of-day Universal Time, roughly 5 in the afternoon Pacific. Smart Africa and the United Nations Food and Agriculture Organization have the 3rd Innovate Africa Challenge open until August 31 for AI-driven climate-smart agriculture.
The deadline is the real filter here. The Spotlight grants take projects of up to 8 months, with final submission by June 30, 2027, and they accept English or French with translation costs eligible, which is the line low-resource applicants most often assume is on them. On the Innovate Africa call, eligibility is restricted to Ghana, Kenya, Malawi, Rwanda, and Uganda, and it is an acceleration and deployment track rather than a fixed cash prize.
The through line today is outcomes over launches. The result that counted this cycle was a mortality endpoint, and what changed around it was the routing. Who gets paged in 11 hospitals, which pipe gets inspected in Bengaluru, who is funded to file a comment in Nigeria, and what breaks next door in Sullivan County.
3 of today's 4 stories are about the layer underneath the model: rapid response teams, inspection robots inside live mains, and a county's siren circuit. The 4th is about who is paid to be in the room when the policy gets written. That is the governance line.
That's Impact Signals for Friday, July 31, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.